Imagine a woman in mid-conversation. She's speaking frantically, her words leaping from one topic to the next, all while her hands aggressively claw a tight scarf away from her throat. This presentation resembles a chaotic psychological event, or perhaps a particularly difficult transition through menopause. In classical homeopathy, these specific, vivid behaviors form a unified clinical signature. This cluster of symptoms defines the drug picture of Lachesis Mutus, as documented in the Boericke Materia Medica. It raises a question of biological logic. Why a hatred of tight collars, such intense suspicion, and nonstop talking always appear together? To understand the patient, we have to look past the individual symptoms and recognize a single biological imperative: pent-up energy demanding a flow. The Lachesis state operates like a closed thermodynamic pressure vessel. Internal energy continually accumulates, pressing against the walls without venting. During sleep, this acts as a catalyst. The external release valves lock shut, causing the internal charge to rise exponentially. Because this pressure reaches intolerable levels overnight, the patient wakes up directly into their symptoms. With the system at maximum capacity, the physical body fiercely rejects any external restriction. Anything tight around the neck or waist, collars, scarves, or restrictive waistbands, feels like a threat to a system that is already overfilled. This same internal tension translates to the psyche. When a system is under extreme pressure, every outside influence is perceived as a potential intrusion, creating a mindset of intense, defensive suspicion. The physical hatred of a turtleneck and the suspicious mind are expressions of the same mechanism, a biological system on the brink, rejecting any further pressure from the outside world. This trapped energy eventually moves, resulting in a violent upward and outward surge through the body. During menopause, this exact surging motion drives the intense, overwhelming hot flushes the patient experiences. The path of this energy is highly specific, concentrating almost exclusively on the left side. In a comparison matrix, sepia shows downward-pointing vectors, indicating cold, dragged-down indifference. Sulfur produces a generalized, radiating heat that is messy, lacking the distinct directional surge of Lachesis. The Lachesis state is defined by that specific combination of an upward surge and an intensely guarded, suspicious temperament. The diagnostic process involves mapping the exact vector and personality of that heat to identify the specific remedy. The final piece of the puzzle is the resolution. A Lachesis state finds peace the moment any flow begins. Physically, symptoms immediately subside when a discharge, a period, or even a nosebleed starts. This recontextualizes the extreme talking we saw earlier. The endless jumping conversation is not just a quirk of personality. This non-stop talking acts as a vital verbal flow, a mental pressure release valve that prevents the internal system from fracturing. Diagnosis is the art of recognizing the whole person, where the mind and body mirror each other in a surging, pent-up loop, one that simply cannot stop.